When we experience a traumatic event or a series of significant stressors, we can be really plagued with isolating thoughts that I'll never get over this, I'm to blame, I'm the only one who's experienced this. And the real power of EMDR is that it can go beyond traditional talk therapy. We get into the unconscious processes that have been affected by trauma. Like I mentioned, we store trauma somatically in our bodies, and through EMDR, through various processes in EMDR, we're actually targeting trauma that is physically stored in the body. So for instance, if we're triggered, we might notice a sudden tightness in our chest that's very similar to what we experienced at the time of the trauma. And traditional talk therapy, unfortunately, isn't going to be quite as effective of getting to that physical piece. And so with EMDR, you're really doing the brave work of confronting that trauma head on, but in a very safe and contained experience. It's not exposure therapy. We walk alongside you, you go through the EMDR experience, and your brain does its own healing. The brain and the mind are incredibly powerful. And so as the EMDR clinician, we actually don't have to intervene that much. We act as a guide, and your brain does its own healing. One of the goals is that visceral physical reaction that I mentioned, that gut punch, that won't be there by the end of successful EMDR therapy. So when you have that trigger, you think back to that memory, you don't have that gut punch feeling. It might never be a good memory, it might always be an incredibly unpleasant memory, but this physical reaction and the strong feelings of shame, I'm alone in this, those won't be there anymore. And it is a lot of work, but it is so profoundly effective, and it is very, very brave work. Many of my clients that have gone through EMDR therapy have really been rock stars, and they have really done the work and seen tremendous progress.